Hello and good afternoon. My name is Aaron Burnell, and I am a resource and information specialist here at the National Limb Loss Resource Center here at the Amputee Coalition. First, I would like to thank you for joining us to discuss some of the different ways in which we are available to you. Some of these resources you may already know, but I hope you will learn about at least one new service or resource that we are able to offer. One of the most common ways to get in contact with us is through phone. We can be reached from anywhere in the country with our toll-free number. That number is 888-267-5669, option 1. Again, that's 888-267-5669, option 1. If we are unable to answer your call immediately, please leave us a voicemail as we strive to reach back out to people as promptly as possible. By far, though, the most common way people get in contact with us is through our Ask an Information Specialist form online. From this form, you can ask us questions, request materials, get matched with a peer visitor or support group, as well as join any of our mailing lists. Regardless of what sort of question we receive, we do our absolute best to answer them. However, as we all know, everyone's experience with limb loss or limb difference is unique to themselves. We are happy to share educational information and resources or referrals to other programs or practitioners, but we are not able to answer any specific medical or legal questions or specific questions regarding your prosthesis. We strive to be available from 9 a.m. Eastern Standard Time to 4 p.m. Eastern Standard Time. As we experience a higher volume of calls with a smaller staff, it is important to remember the Resource Center team is not a call center, nor is it a 211 center. We only have 1 to 2 specialists available at any given time, which is why we ask for your patience and consideration in our getting back in touch with you from either a voicemail or from answering your questions online. The Resource Center is also your one-stop shop for all Amputee Coalition materials. Whether you are a community member or a professional, we can place your order, either for a one-off order for yourself or for a client or patient, or if you are a practitioner or a professional, we can place your bulk orders as well. Community members are always able to order our materials at no cost. Clinicians and hospital partners may also request their materials through us, as well as through the Hospital Partner Program in peer support. Whenever we meet someone for the first time, we always like to offer them a copy of First Step in Your New Journey. Regardless of if you are a community member or a professional, First Step and Your New Journey are always available at no cost. First Step is a book that we publish that is focused on recovery after a limb loss. It includes a bit of a roadmap of people you may meet along the way, including physical therapists, occupational therapists, prosthetists, counselors, and more. It also addresses the different forms recovery can take, including the physical, emotional, as well as social. Your New Journey goes into specific details of the Amputee Coalition's different programs, including peer support, government relations, which includes our lead advocate program, as well as our communications team and the way in which they shape our message out to the community. It also gives you an excellent collection of how to get in touch with us through either phone or email for the entire organization. In Motion is our bi-monthly magazine. It comes out every other month. So for instance, there's a January-February issue, followed by the March-April issue, and so on and so forth. Signing up for the subscription is free and will get you plugged in not only to Amputee Coalition happenings, but also you will be able to see new innovations in technologies and medical interventions relevant to our field and our community. We also are able to profile various members of our community and share their experiences, their successes, as well as their struggles and how they have overcome them. You are also able to view In Motion online through our website, both the current issue and past issues. Other materials include level-specific pamphlets such as below knee, above knee, upper limb, or caregiver, our insurance and reimbursement guide, and helpful trifolds such as securing a successful outcome with your prosthetist, amputees sharing their secrets to success, managing both secondary and or phantom limb pain, as well as occupational therapy. While we are always available to speak with you, we can also understand that sometimes it can be difficult to talk to someone face to face. Because of this, the Resource Center also strives to be a self-service service. Think of it as the self-checkout at the grocery store. Our website, while undergoing some light construction and spring cleaning at the moment, is completely searchable. You can find educational articles discussing different types of amputations, various types of prosthetic devices, and various types of physical therapy, ranging both from inpatient rehab units to exercises you can do at home. The bulk of our resources are contained within fact sheets. These are resources we in the Resource Center have crafted specifically with you in mind. These are short, easy to read documents with very practical information, such as finding financial assistance for a prosthetic device, how to get vehicle modifications, both the products themselves, as well as potential programs or other means of financial assistance, employment resources, and even what to expect when flying. Any webinar we host, including this one, will be available online so they can always be reviewed for information or shared with others. They are also available for any support groups to use in case you feel like sharing some of this valuable information with everyone in your circle. Additionally, through either the App Store or Google Play, you can put our peer support team in your pocket with a free smartphone app. This helps facilitate peer support and connections among our community. Community Connections is a new program that has been in development through the Resource Center since 2019. In the Resource Center, we have collected thousands of resources ranging from the national level all the way down to the county level. Community Connections is our attempt to share all of these resources with you. Much like your local 211 database, you can search Community Connections by your zip code, as well as by the type of resource that you need. For example, you could search for peer support including local support groups, centers of independent living, or disability resource centers, assistive technology departments, or your local disability rights advocate. Our community events calendar is a live calendar of nearly all scheduled events associated with the coalition. This includes events we put on, ranging from webinars like these to our advocacy days and national conference. But also, the community events calendar is meant to highlight, you guessed it, community events. This includes anything exciting you may be doing within your community. Is there an adaptive golfing event or an invited speaker? Perhaps some sort of community picnic? We want to know what you're doing. We have been able to load in all of our certified local support groups, but if you're having any other events, please submit them through the community events portal. We will review and format your information in the Resource Center, and then you can consider the 2.1 million folks who are living with limb loss or limb difference invited. Don't worry though, we haven't had that many RSVP for any of our events yet. The Prosthetist Finder is a tool recently acquired by the coalition. So again, please mind the dust of any construction or updates that you may encounter. Like Community Connections, the Prosthetist Finder is a database searchable by zip code. We are not able to make any direct referrals to specific clinicians or practitioners, but we are able to show you a list of certified prosthetists in your area. You can filter this list of certified prosthetists to various, you're also able to filter this list of certified prosthetists with various pieces that may be important to you, such as being bilingual, offering house calls, or being open in the evenings or on the weekend. One of the key tenets of the Amputee Coalition is that no one is alone in going through their limb loss or limb difference journey. The coalition strives to provide assistance in not only the physical recovery, but also the emotional and social recovery. Literature and self-reports show that many folks experience depression or anxiety-like symptoms, but do not receive any sort of mental health services. While not only affecting things like your self-esteem and self-image, literature has shown that high levels of emotional distress negatively impact both rehabilitation goals as well as overall health outcomes. Because of this, the Amputee Coalition is excited to present a couple new tools. The Improving Wellbeing Program is a tool originally developed for prosthetists, but it's something that you can use at home on your own as well. It is an online program that helps to assess and address the emotional well-being of patients through the use of a self-assessment tool. This program hopes to change the way that you might be thinking about your situation and help you remember what are some of the strengths and techniques you have used for difficult experiences in the past. Finally, the Improving Wellbeing Program is able to offer individualized resources based on the respondents' answers. We hope that this will help you get the resources that are relevant to your situation and cut through information or advice that doesn't address your specific needs. PALS, or Promoting Amputee Life Skills, is an online program designed specifically for folks who are living with limb loss or limb difference. It is an 8-lesson course that is best used either with a buddy or through a support group, as there are many opportunities to share your answers and what works for you and what doesn't in regards to living well with limb loss or limb difference. With the assistance of Johns Hopkins University, PALS is being expanded as we speak to include a module geared towards the unique experience of returning to work after experiencing some sort of limb loss or limb difference. Our peer support program is one of the tent poles of the Amputee Coalition. Since the pandemic closed the doors to many of the local support groups, we have been able to start offering weekly virtual support groups every Thursday evening. These virtual groups are facilitated by certified support group leaders from across the country and are a great supplement to local groups as they reopen their doors, while also being a bridge to community members who might not have a group locally or who may struggle with transportation. Our certified peer visitor program, also known as the CPV program, is built around the concept that no one is potentially in a better position to understand about living life with an amputation or supporting a person with limb loss or limb difference than someone who has been there themselves. An experienced and well-trained peer can offer encouragement and information from a place and at a pace that an individual in this circumstance of being a new member of our community can best absorb. We are proud to be able to offer one-on-one peer support for anyone living with limb loss or limb difference, those who are considering an amputation or having an amputation surgery pending, youth and pediatric patients, as well as their families and caregivers, veterans, as well as spouses, partners, parents, or other caregivers who are struggling with a loved one's limb loss or limb difference. Thank you so much for your time and attention as we have discussed some of the different resources available through the National Limb Loss Resource Center. If you ever want to reach out to us, remember we are just a phone call away at 888-267-5669, extension 1. We look forward to speaking with you, and we'll be able to open up the floor for questions in just a few moments.